this edition of The Signal, HIV is on the rise in Nova Scotia. Dal Health Promotions advocates for more testing.
To get tested for HIV is really what the posters are all about.
The Board of Police Commissioners votes against funding for an in-house psychologist for the police.
I wouldn't separate the mental health of officers from the other problems of policing.
And will she or won't she? It's Groundhog Day. Welcome to The Signal. I'm Angela Capobianco. And I'm Anna Mandin. Some Kings and Dow students may have noticed new posters around campus. They warn of a rise in HIV cases in Nova Scotia and encourage students to get tested. The Signal's Rye Pembroke has a story.
Sexually transmitted infections are on the rise, and Dalhousie's student health promotions team is on the case.
All right, there you go. You take this over to her, and she's going to take care of you.
This is a pop-up clinic on King's campus, trying to draw more students in to get tested.
So yeah, we do the pop-ups just to make testing easier. Sometimes it can be nerve-wracking for students to go get tested or even book an appointment to go into the center.
The pop-ups only test for chlamydia and gonorrhea, but posters around campus are pushing for more HIV testing. Nova Scotia Health expects between 15 and 20 new HIV cases every year. By August of 2022, they had already seen 20 to 25 new cases.
So encouraging students to pop in to book a blood requisition to get tested for HIV is really what the posters are all about. And just letting students know that, you're not the only ones who get tested. There's a lot of students who get tested every year for HIV to really kind of help normalize testing.
In the meantime, they're hoping to make STI testing more accessible, available, and friendly.
We just have a couple test options for you here today. I think by having these clinics in so many different locations on campus, it is making it more of a welcoming space for students, which is great. I guess personally, as a Black individual, I do find that sometimes going to the doctor can be a scary thing. I hope that we're able to represent the student body in what we bring to the clinics, and that makes it more comfortable for students.
And when you're done your test, you just give it to them?
The team says they tested 45 to 50 students on Tuesday afternoon.
5 business days. Great. So no news is good news.
Okay. The next pop-up clinic happens on March 8th at Dalhousie's Sexton campus. For The Signal, I'm Rye Pembroke.
When the Halifax Sexual Health Centre announced that they were offering free appointments for people seeking hormone and surgical readiness letters, they were overwhelmed. Trans and non-binary people quickly booked up all available appointments. Declan Zion-Roll reports.
The Halifax Sexual Health Centre began offering free appointments for trans and non-binary people. Appointments to get readiness letters. Those letters are essential to unlock services for gender-affirming treatment. The Mental Health Foundation of Nova Scotia gave them the grant to do it. Executive Director Abby Ferguson.
So when we asked for this grant, it was to both do in-house psychosocial assessments for free to patients. We know that trans folks often have income concerns as far as for paying for those therapy services, and they can get pretty pricey pretty quickly. And then there's longer wait times in the public system. And then on the other hand, our social worker is also going to be helping us move towards an informed consent model.
Based on 2021 census data, Nova Scotia has the highest proportion of trans and gender diverse people in Canada, around 0.48%. The appointment the centre books are with social workers.
So all of those providers, so a psychologist, a social worker, a counseling therapist, all of those folks are qualified to write readiness assessment.
After the announcement, they were bombarded with requests for appointments.
Okay, we were already booked till the end of March, so we paused it there. Like with our other services, if we don't pause booking for periods of time, we'd literally be booked 6 months, forever on out. So we paused it there, and we're going to reassess and get our social workers like later spring and summer schedule, and then start opening up booking again. But clearly there's demand.
Dante McDonald began their transition 5 years ago. They need a readiness letter to begin their treatment. It wasn't easy to get.
I think I was like 15 and I needed a readiness letter from a gender therapist, and to get that letter it was basically a year's worth of therapy from them, and then you were able to get to see the endocrinologist. But with seeing the endocrinologist, you there was a wait list for a year. That's how many people were on this list to see her.
It takes at least a year or a year and a half to receive a readiness acceptance letter. But with this new temporary service that will be offered, McDonald is happy that this will make others' journeys easier to progress.
I saw it on their Instagram page and I reposted it to my Instagram story because I thought it was something really great that they were doing, because I know how hard it was when I went through my transition to get my letter and everything, and now I'm happy that it's going to be so much easier for people.
Declan Zion Roll, The Signal, Halifax.
The Halifax Sexual Health Centre says they hope people can start booking again in March. And Angela, I heard there's a new gallery in town. You covered the story. Can you tell me a bit about it?
Well, Anna, it's a collage gallery, and it's the first in the country to showcase multiple artists who do this kind of work. I went to talk to the person behind it all. A room the size of a parking space. This is where Rhonda Barrett has created Canada's first gallery for collage and assemblage. She's here Monday to Friday working on her own art, as well as showcasing the works of others. With a background in architecture, Barrett carefully cuts and organizes pieces of paper to create her work. She started doing collage when she became pregnant with her son. The accessibility of the medium was attractive.
The accessibility of collage was that I could just run across the street, and at the time the Coast was a printed paper and free, which was nice. So I took a few of those, I went home, and I had memories of when I was in Newfoundland growing up. There was no art classes, there was no art stores to go get materials, and so you kind of worked with what you had. And so this affinity for paper was always there because it was always readily available.
Barrett saw that galleries didn't include collage and assemblage. Barrett experienced pushback from galleries about her own work. So she decided to create a space for collage artists to exhibit their work locally.
Yeah, to have this space, it was super important to me. Because as a collage artist myself, I've had pushback from certain galleries about my materials or my, the reason why I use newspaper over some other type of paper.
This is wonderful.
Collage artist Peter Krause celebrated the opening of the gallery. He's a collage artist from Middleton who makes his works out of items he finds. Finding things and making things out of them has always been a big thing for Krause. His work is very personal.
I grew up on a farm, and I used to build forts with my friends. I built forts right up until I was in grade 12, quite elaborate forts, and I love just putting stuff together. We would go to the dump, we would find wood, we would build stuff, and so most of my artwork is kind of an offshoot of that.
Although the space is small, Cuts and Paste says that they welcome everyone. Angela Capobianco, The Signal, Halifax.
Barrett is also offering workshops for anyone interested in getting involved in collage.
The Board of Police Commissioners decided against some upcoming funding for the police force. Anna, I understand you're at the board meeting.
I was. The board voted against funding for an in-house psychologist. I heard some mixed opinions about that decision.
Police are some of the first on scene to accidents and tragedies, but Halifax Regional Police still don't have an in-house psychologist. Dean Steinberg is the president of the Halifax Regional Police Association. The association was hoping the city would approve funding for an in-house psychologist.
The role of the psychologist in this situation would be to assist our disability case manager with their caseloads and doing assessments and assisting to determine what officers may need to keep them healthy and keep them at work.
On Monday, officers watched as the Halifax Board of Police Commissioners debated the latest regional police budget request. Included in that, a new position for a psychologist.
Proposed service enhancements described in the revised...
The $94 million increase in the budget, mainly for inflationary raises for officers, was approved by the board. 5 new positions, including an occupational health nurse and the psychologist, were not.
Motion failed.
We were a little disappointed. We feel that they are important positions to help support, health and wellness.
In 2021, though the Halifax police wouldn't give numbers, they shared a graph showing a dramatic upswing in mental health claims since 2011. Elle Jones chaired the subcommittee to define defunding the police. She says that police officers' mental health problems are part of a bigger problem.
Rather than treating it as an individual problem, like as in this person has this symptom and now their mental health is bad and now we have to intervene, we could perhaps be looking more broadly about how participation in these systems and our investment in these systems has a knock-on effect, including into officers involved in it. That is, I wouldn't separate the mental health of officers from the other problems of policing.
Halifax Police Chief Dan Kinsella had presented a report asking for the new roles. He declined an interview.
I'm not going to be commenting on the process tonight.
This Friday, the police budget will be reviewed again by the Halifax Budget Committee, but it won't include funding for an in-house psychologist. Reporting for The Signal, I'm Anna Mandan.
The public is invited to attend the meeting this Friday.
For the past 2 years, Shubie Sam has been alone in the search for her own shadow. Finally, a crowd was able to gather this morning to witness the furry forecast. Katie McKenna braved the cold in Shubie to bring us the story.
Local groundhog Shubie Sam saw her shadow today at Shubie Wildlife Park. According to local superstition, this predicts another 6 more weeks of winter.
I'm here with Dr. Andrew Morrison, the veterinarian at the Wildlife Park, to ask him a few questions about Shubie Sam. What is the significance of this Groundhog Day for you?
So Groundhog Day is a really, old tradition from the 1980s here at the park, and it's really a chance to have, the family out, get some fun, let people come into the park and learn a little bit about the wildlife that's here.
The time zone here in Nova Scotia makes Shubie Sam the first Groundhog Day prediction in North America. This was the first in-person Groundhog Day celebration in 2 years after pandemic-related restrictions. Groundhog Day signifies the end of the darkest 3 months of the year.
But Sam always gets it right, but the weather sometimes gets it wrong.
So, what do you think of the accommodations here?
For The Signal, this is Katie McKenna, Shubie.
So that means 6 more weeks of our continuing mild Halifax winter. Except for this weekend, of course. Bundle up, Halifax, it's a cold snap here. I'm Anna Mandan.
And I'm Angela Capobianco, and this is The Signal.
See you next week.
Yay.